Kia ora, I'm Shuri Kinnear and this is the COVID-19 news update for Wednesday. Omicron is continuing to creep into the community with 15 new cases of the highly infectious variant reported today. The cases are in Auckland, Taranaki and Nelson Marlborough, and it brings the total number of cases in the Omicron cluster to 56. That includes 44 cases linked directly or indirectly to the family event and other associated events in Auckland on the weekend of January 15th and 16th. Meanwhile, there's been no additional cases linked to the Auckland airport worker whose infection was reported on January 19th. The new cases are part of 23 total new community cases of COVID-19 today, and there are 6 people in hospital. More Auckland high-risk locations have been added to the list of exposure sites, which now includes 6 flights, 3 bus routes, a liquor store, a bakery and a wedding that had up to 500 guests. Wellington Airport and a check-in counter have also become sites to be added to the growing list of locations. On vaccinations, the number of people getting boosters has increased since Omicron was first confirmed in the community, with more than 56,000 people getting their 3rd shot on Monday, the highest number in one day so far. More children also got their first jabs too. Yesterday, the government announced new mask-wearing protocols in a bid to slow the spread of Omicron. Face coverings must now be actual masks, not bandanas, scarves or shirts pulled up over the face, and all workers under the mandate must wear medical-grade masks. Meanwhile, Associate Health Minister nzherald today revealed more details around the government's plan to manage the rollout in stages.
As case numbers grow, both testing and isolation approaches will change in response. We have been planning for 3 phases for Omicron. Phase 1 is where we are now, and we're doing what we have successfully done with Delta, using our tools from a stamp-it-out approach. This will all be familiar to you. The tools we have used to stamp out outbreaks in the past can also be used to slow the start of an outbreak, giving more time for people to get boosted. In Phase 2, our public health efforts aim to slow the spread of the virus. The system will focus more on identifying those who are at a greater risk of severe illness from Omicron. Testing remains a cornerstone of our response, but when and where and how we manage our testing will change once Omicron becomes seeded in the community due to its highly infectious nature. Rapid antigen tests will become the go-to testing tool. They perform best when case numbers are high and can give a quick result without drawing on laboratory or transport systems. At the 3rd phase, our public health response will be about minimising a widespread outbreak. When cases are in the tens of thousands, we will then make further changes to contact tracing. Locations of interest and push notifications will be paused, but keeping a record of where you've been by using the COVID Tracer app will be important as it is now. Today we've gone through the details of public health operations so that everyone understands that the response will change as the outbreak does.
And that's the latest COVID-19 news. For more and to stay up to date, head to nzherald.co.nz. Thanks for checking out our YouTube channel. To stay up to date with all the latest news from the New Zealand Herald, click the subscribe button below or check out one of the videos here, and head over to nzherald.co.nz for more details on these stories and more.